Chapter 26, Crisis and Disaster. There are many characteristics of a crisis, and this is a disturbance caused by a stressful event or a threat. Disruptions to an individual's homeostasis or equilibrium. Their normal coping mechanisms fail, which results in an inability to function as usual. Successful crisis outcomes have several factors, everything from realistic perception of the event, adequate situational support, and adequate coping mechanisms. In our first case study, Mr. and Mrs. Alessandro are devastated when a faulty ceiling fan causes an electrical fire in their home. Last Wednesday, they came home from dinner with friends to find that not only was their home destroyed, but their cat, Alfie, is missing. He hasn't been seen since. Insurance is paying for their temporary stay in a tiny apartment for now, but Mr. Alessandro tells you that the place just adds to my wife's depression. I can't get her to do anything with me, not even take a walk, which she usually makes me do. We do go to the old neighborhood every day, looking for Alfie, but we're starting to lose hope for him. There are many different theories on crisis, such as Eric Linderman and his behavioral response to crisis are normal, and Gerald Kaplan, which is the outlined interventional strategies grounded in homeostasis and equilibrium. There are also many different types of crisis. The first would be a maturational crisis, and this is a new developmental stage is reached. Old coping skills are no longer effective and leads to increased tension and anxiety. There could also be a situational crisis, and this arises from events that are extraordinary, external, and often unanticipated. Examples would be things like a job loss, a death in the family, or a change in financial or marital status. Others may be adventitious, such as natural disasters, epidemics, floods, fires, and earthquakes, or human, such as one-on-one violence, acts of terrorism, wars, riots, shootings, and bombings, or even accidental, such as an airplane crash. First, let's talk about the phases of a crisis. In Phase 1, a serious stressor or problem results in increased anxiety. This stimulates the usual coping methods and defense mechanisms in an effort to address the problem and decrease anxiety. Here, the sympathetic nervous system may be kicking in. In Phase 2, the defense mechanisms fail, so the threat persists. Anxiety increases, producing feelings of extreme discomfort. Functioning becomes disorganized, and trial and error attempts at a problem solving begin. After these trial and error attempts fail in Phase 3, anxiety can escalate to severe or panic level. Automatic relief behaviors begin mobilized, such as withdrawal and fight and flight, and some form of resolution may be devised, such as compromising needs or redefining the situation. For Phase 4, problem is unsolved and coping skills are ineffective. Anxiety overwhelms the person and can lead to serious personality disorganization, depression, confusion, violence against others, or even suicidal behavior. Mr. Alessandro returns to the clinic 10 days later, bringing his wife with him, though she is resentful. "I don't want this," she says. "Why can't people just leave me alone?" Mr. Alessandro does most of the talking, as his wife is clearly withdrawn. He talks about things he's done to try to cheer both of them up, but everything's failed. Ellie is withdrawing from everyone. She's so depressed, and me, I'm a basket case because I'm afraid we're never going to recover from this. Last week I was driving to the grocery when I had to pull over because I couldn't breathe. I think it was my first ever panic attack. During therapy, the nurse and Mr. Alessandro propose a move to a nicer, larger apartment while they wait for insurance to begin the process of helping them build a new home. "There's that new complex near the park where we used to walk," Mr. Alessandro says. "We could walk the trails there like we used to without having to drive so far. There's a fitness center and even yoga, and when you're ready, we can think about adopting a cat." "I'm not ready to replace Alfie," his wife says, but after a moment she softens and says, "I'm sorry, Robert. Those new apartments by the park, though, I'd like to see those." Poor Alfie. For our first audience response question, which phase best describes how the Alessandros are doing right now? Phase 1, 2, 3, or 4? And the answer would most likely be possibly B, possibly C. Although identifying these phases is seldom completely cut and dried, you are correct in choosing either Phase 2 or 3, though Phase 3 is more likely. That trial and error has failed, and while Mrs. Alessandro uses withdrawal as a coping mechanism, Her husband's anxiety has turned to panic. This is not phase 4 because no one's suicidal, and both are open to considering a realistic solution. The application of the nursing process. For our assessment, we'll include a general assessment along with the patient's perception of the precipitating event. Identify their situational supports, their coping skills, and their own self-assessment of the situation. There could be many nursing diagnoses we could use here, such as risk for impaired coping, risk for or actual impaired family coping, and risk for impaired community coping, as well as anxiety. For planning and implementation, we want to identify patient safety as a top priority, and also incorporate things like anxiety reduction and identifying an appropriate level of prevention and debriefing. Everyone's favorite terms: primary, secondary, and tertiary prevention. Again, in primary prevention, we're promoting mental health and reducing mental illness to decrease the incidence of crisis. In secondary prevention, we're using interventions in an acute crisis situation. And for tertiary prevention, we're, again, recovering from that crisis event, providing long-term support for those who have experienced that crisis. For critical incident stress debriefing, we could consider a tertiary prevention tool such as the 7-phase group meeting. Those 7 phases include introductory, fact, thought, reaction, symptom, teaching, and reentry. Other examples could be to debrief staff on an inpatient unit following a patient's suicide, debriefing school children and school personnel after a school shooting, or debriefing rescue and health workers who have responded to a natural disaster such as a hurricane. Dealing with crisis could come in many different treatment modalities. First would be an emergency room. While not ideal, this is often where patients in an extreme crisis end up. Also, behavioral crisis care services such as crisis call lines, warm lines, crisis intervention teams, and crisis stabilization facilities. Similar to crisis hotlines, warm lines provide confidential telephone support. And unlike those crisis hotlines, warm lines are not designed for crisis situations, but to prevent the escalation of distress. For psychiatric advanced directive planning, proactively addressing a crisis situation before it occurs can help lessen the fallout. Usually advanced directives are used in end-of-life situations. In psychiatry, these plans take the form of a document that's developed by the patient to be used in crisis situations when the patient's unable to make decisions. This would include things like treatment choices, treatment facility providers, and other designated support personnel. For our next audience response question, a single parent has just lost her job and calls a warm line in her community. This is an example of A, tertiary prevention, B, primary prevention, C, secondary prevention, or D, critical incident stress debriefing. They threw you off. They didn't put them in order there. And that answer is going to be C, secondary prevention. And this establishes an intervention during an acute crisis to prevent the prolonged anxiety from diminishing personal effectiveness and personality organization. After safety issues have been addressed, the nurse works with the patient to assess the patient's problem, identify their support systems as well as their coping styles. Desired goals are explored and interventions are planned. Primary prevention would promote mental health and reduce mental illness to decrease the incidence of crisis. Primary would occur before the crisis has occurred. It's about preventing that crisis. Once that crisis has occurred and we're dealing with an active crisis, that's what made it secondary. And in her long-term recovery, that would be tertiary prevention. And disaster response. There have been a lot of global disasters, especially in the last decade. Large-scale crises such as tsunamis, hurricanes, wildfires, large-scale depletion of natural resources, international stock exchange collapses, and pandemics. For disaster preparedness, we want to develop resilient communities, assess disaster risks on a local level, extend to networking communities, and extend to larger societal and national programs. Unfortunately, one thing you can be certain of is that some sort of disaster or crisis is going to be coming again next year. Maybe they're going to be rare for each area, but it's better to be prepared than not. For FEMA's 4-phase disaster management continuum, they would have phases including mitigation, preparedness, response, and recovery. Other disaster management organizations would include the Department of Homeland Security. This includes civilian first responders, local emergency response professionals, and created the National Incident Management System. That National Incident Management System works to coordinate first responders and provides an incident command system. The Department of Homeland Security coordinates United States responses to U.S. disasters and has the ultimate responsibility for U.S. safety. It assures immediate availability of preparedness, response, and recovery protocols. It uses civilian first response professionals and created again that National Incident Management System to coordinate efforts between responder agencies. And that really does go a long way. There's going to be a wide variety of different, you know, ambulance response teams, fire departments, and it's going to keep everyone coordinated so they're all working together and it's going to be able to provide much more care much more efficiently when responding to that disaster. And wrapping up, a Category 5 hurricane destroys homes and businesses in a community. How would this crisis be classified? A. Accidental, B. Situational, C. Adventitious, or D. Maturational? And that's going to be C. An adventitious crisis. A natural disaster like a hurricane is a type of adventitious crisis. The term adventitious coming from Latin adventitious, meaning coming from outside, and advenire, I'm sorry if I'm butchering the Latin here, meaning chance happening. An adventitious crisis, then, is a traumatic and external event that happens unexpectedly. This type of crisis may be natural, human, or accidental. Natural disasters may be the result of such events as epidemics, floods, fires, and earthquakes. Unfortunately, natural disasters do occur, and best thing you can do is be prepared, man. Make sure you've got a few days worth of food and water on hand. Make sure you've got some sort of family meeting place and a way to communicate. But anyway, that's all we've got in these slides. I'll see you in the next chapter.